Hello, everyone, and welcome to the VAC Roundtable. We're up to number 98, and another special one for us. I cannot tell you how much I love and respect this man. I've been able to share him basically on Hash Church for the last decade. And let's see. Ta-da, there's the title. And he is basically one of the most knowledge chemists I know regarding cannabis. And so our group had enough time pass that we're like, it's time to call on the floor Dr. Mark Sheldone. So, Dr. Mark Sheldone, thank you for joining us tonight.
Well,
And we'll
thank
get right into it. First question.
yeah,
It's a
thank you for
multi
the invitation, ATN. Thank you so much for having me.
Oh, it's an honor. So the first question is, how did you originally come to cannabis? And this is multi-tiered. When did you first hear of it? When did you first try it? And when did you realize it was part of your life?
Oh gosh, that's an interesting avenue of thought to pursue. So let's see. I remember first trying it with a cousin of mine who was older. You know, I had some older cousins who were sort of children of the '60s, and growing up in the '70s, it was just yeah, kind of counterculture thing. Cannabis was. It wasn't as mainstream as it is today. That's for sure. And but what really turned me on, which is no secret, is after seeing the Grateful Dead. Well, I went to my first Grateful Dead show right at the beginning before I started high school, and from there on out, it was just being acquainted with Northern California weed as opposed to what we could buy. I grew up in suburban New York City, northern New Jersey, and when we can go buy weed in Manhattan, it was always these little manila envelopes full of seeds and stems. You were lucky to get one joint of some brown weed out of it. But at the Grateful Dead show, you were getting, that really dank Northern California bud that, yeah, I attribute Grateful Dead tour for bringing kind bud out of NorCal and bringing it to the world because wherever the Dead played, there was really good weed being smoked. So part of it, yeah, was certainly an association with the Grateful Dead and the Grateful Dead culture. And being a kid growing up in northern New Jersey, I grew up at the right time. Grateful Dead would come and do East Coast tour, and just yeah, we'd be able to see them handful of shows within a couple hours drive. So yeah, it was a lot of fun growing up when I did in North Jersey. So yeah, I'd say it was Grateful Dead, and I knew it was going to be the rest of my life after I kind of discovered that a friend of mine who said, "Hey, you got to come to a High Times Cannabis Cup." This was in 2014. I went to the Santa Rosa Cannabis Cup, and this was I think after Colorado had legalized, and maybe after maybe one other state, maybe Oregon, or I forget the first two to legalize, but it was after Colorado had. And they said, "Hey, we need chemists like you to participate in this industry." And I saw it was a very eye-opening event for me because, as you know, AT and around that time there was this big movement towards concentrates, and so there's a lot of chemistry when you're concentrating, the medicine off the plant. So yeah, I felt like at that point I knew it was going to be not just something I enjoy doing, but something that I'm going to be around for the rest of my life. And now I'm a professor and I educate students on the chemistry of the plant, and it's just pretty full circle moment now, knowing that yeah, you're not only enriching your own life, but you're enriching the lives of others.
Well, that's a fascinating journey. Well,
Yeah, so far
uh,
so good.
all right. Well, it's true to form for you.
Yeah, so blame Garcia.
Right? Or
like
pigmen.
many things. Yeah.
All right, let's get to Nate. He's got our next question. Councilmember Landau, you're recognized.
I would say thank you, Garcia, for influencing you, and
Yeah.
thank you so much for being here. My question is, from a chemist perspective, what is the most important safety distinction between natural expressed cannabinoids and chemically converted cannabinoids now common in the marketplace? Thank you.
That's a great question, Nate. Um, so, um, yeah, humans have been using cannabis for millennia, and it's no happy accident that the CB1 receptor that interacts with THC is one of the most prevalent receptors, if not the most prevalent receptor in the frontal neurocortex, which is like the sort of most developed area of the brain. And so humans have co-evolved with this plant, and we're now experimenting with the chemistry of the plant due to regulation mostly. If you can't have access to whole cannabis extract and whole cannabis and quality cannabis products, you might be in a state where it's easier to get a Delta 8 or some kind of synthetic product, whether it's from a legal or quasi legal or illicit market. It's just something that, again, humans don't have a lot of experience with. So, from a safety perspective alone, Nate, you want to really stick with whole plant medicine. I mean, that's what we have the most experience at in terms of understanding safety profiles. I mean, could someone take too much cannabis or, ingest a brownie and have to take the next day off of work, right? Because they're just completely overwhelmed. I mean, we'll talk about this in a later question, but the roots of administration is really important. And, there are, products that are out there today that are basically plant identical, where it's almost very, very difficult unless you do very, very sensitive analytical testing to actually discern whether that THC molecule came from a plant or whether it came from a chemist's synthetic vat of soup, you know? So it's really important, I think, to make sure that, we still push to end cannabis prohibition so people have access to whole plant medicine and save the synthetics for the researchers like me who are looking at developing new medicines based on what the plant provides. And don't use those recreational, use high quality cannabis and cannabis products made from, good varieties from decent growers who aren't growing, with pesticides and making moldy weed. I mean, there is high quality cannabis out there. So I always say stick with the high quality cannabis products and try to stay away from synthetics. Synthetics will get you to the same place, but yeah, the supply chain could be unreliable and you never know what you're getting in some of these products. Great question.
Thank you for that. All right, next up will be Leslie.
Thanks. Does Mike have a follow-up?
Yeah, if you
Mike
don't
has
mind.
follow.
Um, First, let me just say again, welcome and thanks for hanging out with us.
Oh, you
You and
bet.
I must have crossed paths at least at some point. I saw my
Yeah.
first Grateful Dead concert in 1978, I think it was.
Yeah,
It was
77. So
like
yeah, it's right at the
yeah,
same
and then
time.
the last one I saw was I think the last tour. So I didn't see that many in between, but
1995, before Jerry died.
yeah, yeah.
Yeah, same here. Yeah.
So that was in like RFK, and the first one was in Madison Square Garden. Madison Square Garden, my very first concert, um, first Dead concert. I think my second concert that I ever went
That
to. I
would be
think I was like Yes
79.
before that.
Yeah, they
Yeah,
didn't play
so
Madison Square Garden until January of 79, right?
there you go,
We were there. So
79.
last Keith and Donna shows. And then my first Brent show was also a Madison Square Garden show in September of 79. So you may have been at those shows too, Mike.
Oh my gosh, yeah, I just went to the one, whichever one it was in '79. It wasn't particularly cold, so I remember that.
Was Brent
And I
there or
remember
was Keith and Donna there?
I remember Shakedown Street and Terrapin Station, and it was just such a
Oh, those may
phenomenal
have been the
concert.
ones in January with Keith and Donna, right? Those were good shows.
Yeah. So anyway, much love, and yeah, another North Jersey boy. I grew up in Fair Lawn, New Jersey, sort of north.
Yeah, I grew up in Rivervale, right up the road.
Yep, yep. So I do have a question for you.
Yes.
For those watching this, I'm about to talk about something, cannabis hyperemesis syndrome. And if you're interested in that, we did a video with Dr. Ethan Russo that was really good. A deep dive, the whole, more than an hour into cannabis hyperemesis syndrome. But it strikes me, this question that you just answered, it, it's, when we first heard about the syndrome, I mean, first we're a little skeptical because Kevin Sabat was saying stuff that clearly was not true. But in there was a kernel of truth. There is an issue, and certainly it is deadly, and it can be treated essentially by a hot shower or discontinuing cannabis. Quite strange, but when I really looked at it, and we looked at it, the first things that were said, like, oh, well, this cannabis is being, they're using more cannabis today, or they're using stronger cannabis today. Those arguments fell flat on me when I looked at Park Davis, records of what people were using in 1920. They had some pretty good stuff, and there's no record of this at all. So what it led us to sort of come to the conclusion of is likely one of two things: either we're somehow preparing the cannabis different, or we're using the cannabis different. And I think the question for you is, do you have any insight into that? Do you have any thoughts about cannabis hyperemesis? I assume by now you know at least a little bit about it. Um, it certainly has a genetic component. That's what Dr. Russo taught us. But is there something that you can put a finger on that we're doing differently today? I mean, Dale Gerens and I, when we first looked at this, we thought pesticides. It's the first word came to both of our heads. So I don't know if you have any insights at all into what might be different in the way we're using cannabis or the way we're preparing cannabis, or if there's some other idea that you have about cannabis hyperemesis and why it's showing up today.
Yeah, well, am I feeding back? Can you guys hear me?
Sound
Much
good?
much better.
Okay, much better. Okay, I put headphones on. Yeah, so couple things with that. Um, so yeah, I think Ethan's correct. The other person I would point you to, and I think there's a couple videos up on YouTube. I think most memorably would be last year's CanMed CHS panel. Dustin Sulak really shared some very compelling data because you can't argue with data, right? That's a great thing about science, right? Everybody can look at the data and everybody in the room is convinced that, yeah, this is a real thing. No, it's not caused by neem. And, again, there was this notion that exposure to, weed that was, treated with neem, the active ingredient is something called azadirachtin, is that could actually cause vomiting, and I think that's pretty much been disproven at this point. What Ethan will agree to, and I think what the data suggests, and even like if you look at Dustin's patient case history, is that there are certain portions of the population that are just pre-genetically disposed to this condition, right? And think of it like this, Mike. I mean, it's just such a great discussion point because you could easily see how prohibitionists like Sabat and that organization would sink their teeth into it. And I remember seeing this one image that was this, I think, alcohol distributors group on LinkedIn, and it showed some cartoon character hugging the toilet saying, see, this is what happens when you smoke weed, right? And they showed somebody, basically vomiting. But what it is the that and it's really interesting to consider too that many processes in biology and especially in the human body where there's multiple systems that are basically governing how our organs work and how your central nervous system keeps your heart functioning, even when you're freaking out, and even, your autonomic nervous system is kind of like your hard drive. It keeps on going. And the one thing about that reflex is that, remember what Professor Mishulam showed, is that below psychoactive levels, THC given to children who were having chemotherapy and then suffered from nausea associated with chemotherapy completely blocked all nausea. And so what that says is that, yeah, there is something biochemically happening in the body with very low, okay, that's just it, very low doses. So there's many things in biology that have a what's called a biphasic response. A biphasic response. And what a biphasic response is it depends on the dose. And so at very high doses, you could see again where this control of this reflex that we have, again, if your gut feels like, oh, I just ate something, like I just drank a lot of beer, or I just swallowed half a bottle of vodka and I can't keep this in my stomach. And it's a natural, almost immune. No, I wouldn't say it's immune response, but it is. I think, yeah. Again, that gag reflex is something that can, again, be something that your endocannabinoids system has a way of controlling because it's part of maintaining homeostasis, right? And so, again, what I would say is that CHS, yes, can someone like take a rip from a dab rig that's maybe only used to like smoking joints, or not really, like my wife doesn't dab, but like even people who aren't used to, use the proverbial metaphor of drinking water from a fire hose, right? I mean, when you're flooding your CB1 receptors intensely, like I've pulled rips where I'm like, holy shit, I'm so glad I'm not behind the wheel of a car. I need to sit down. If someone tries to pass me a rig, like ATN, I'd be like, oh no, give me a couple of minutes here, right? Like I've completely like saturated my system. And yeah, do I feel like I'm going to vomit? I think I feel like I need to sit down. I could feel a little dizzy. I think with some people, it can push them over that limit, Mike. And some people maybe are more prone to others to be like, oh, I'm in that state. I'm dizzy. I'm losing my equilibrium. I'm just going to throw up everything. So, I don't think it has anything to do with, again, I think the notion that this was somehow now there is something that I will mention, and this is coming up in the news a lot. So our friend Kyle Boyer has been educating people, and Tess Item and others, on these things called microtoxins. And microtoxins are, think of like when bread goes moldy, right? And some of that mold is called penicillium. Penicillium emits penicillin in its region because it doesn't want other species of fungus to invade its food source, namely the little piece of bread that's gone moldy, right? And so those compounds that the fungus emits, we call them antibiotics, right? Because we harvest those and we use them to fight disease, because basically those compounds are basically cidal to other things that, yeah. So it's basically the fungus's defense mechanism to basically make sure it maintains its food source. So on cannabis, when fungus can live on cannabis, and fungus is like fusarium, they emit those kinds of compounds. And one of the compounds is termed vomit toxin. Yes, vomit toxin. It's a mycotoxin that can exist on cannabis. And there is, I guess, data or things that support that humans exposed to that could potentially trigger, again, a CHS type event. I don't really know. I mean, it depends really on the level. It's interesting because aflatoxins are mycotoxins, and those are like the peanut toxins. And those are, if you ever see or have heard about rotten peanuts, when peanuts go rotten, fungus grows on them. Fungus emits these aflatoxins, and these aflatoxins are super, super toxic. And so I don't know why, but they test cannabis for aflatoxin, even though there's no incident of aflatoxin ever occurring on cannabis. But they test it anyway. But there's another one called ochratoxin, and ochratoxin can occur on cannabis. And there might be other microtoxins, just to finish the question, Mike, that are could be part of contaminated cannabis that, if consumed, perhaps could trigger a CHS type episode. But I think there's still a lot of research that needs to be done on whether or not smoking it completely neutralizes the material. I don't know. And the amount of material that's found on cannabis is really exceedingly small. So these things would have to be super potent. But aflatoxin, the stuff that grows on rotten peanuts, is super potent. There's like several deaths a year that happen because of rotten peanuts. So let's say it right here. Cannabis is safer than peanuts.
Duly noted. And yeah, that's yeah, very much fucking true, to say the least. All right. So next up will be Rachel. You've got the next question.
Oh, you skipped me though.
Oh, did I? Do I go
You
to three?
did.
Oh, sorry.
Sorry about that.
I'm so
It's all
far ahead
good.
down the line. Sorry, Rachel. I'm at 3. Sorry. That's right. Michael was doing a follow-up, so I
Yeah.
skipped to 4 mentally. Sorry. All right. So Leslie.
Yeah. So, Mark, with so many folks, including veterans, seeking cannabis as an alternative to pharmaceuticals, what advances in cannabinoid formulations and delivery systems, such as nanoemulsions, show the most promise and for consistency and predictable therapeutic effects?
Yeah, that's a great question. This huge explosion that you see, we've talked about this a bunch on Hash Church, hey, ATN, in the beverage sector, has only been made possible by really applying pretty state of the art type formulation work to, as you know, cannabinoids are not water soluble, right? Rachel, you ever try or Leslie, you ever try cleaning your bong out with water? It doesn't work too well, right? Um, so so the nano emulsions are really very important for several reasons. I mean, when they take uh, oil soluble materials and emulsify them with water. So think of oil and vinegar, right? Is a perfect example, right? The oil separates out from the vinegar because oil isn't water soluble and water isn't oil soluble, so they happily exist as two layers. But when you shake them for that microsecond of a time, you have a perfectly mixed salad dressing, right? The oil is completely mixed with the vinegar is completely, and so there's a compound called, or a set of compounds called emulsifiers, and what they do is when you mix up those two phases of oil and water, the emulsifiers emulsify the oil within the water. And so think of it like milk. Milk is a perfect example because milk is emulsified oil in a water phase, right? And you could infinitely add water to milk and it never separates out a separate oil phase, right? Because the natural glycolipids and whatnot in milk will keep it beautifully dispersed and everything. So what happens with these cannabinoid nanoemulsions is they use sonication or they use high pressure microfluidization. There's several techniques to basically take those oil droplets and make them as small as a nanometer, or actually they're more like 100 or 200 nanometers in size. But I mean, that's super, super small. I mean, that's 10 to the minus ninth meters. So you can imagine that, again, these are so small that within that nanoparticle or a nanoemulsion, you have this oil phase, which has got your cannabinoids solubilized. And now these things can go through cell walls and they can really increase the overall bioavailability. And I was super skeptical of this. ATN knows this. I'm like, man, I don't think that stuff really works. I don't think. And then I drank about half of one of these beverages that was only a 10 milligram beverage. And for half of a 10 milligram beverage, that would be 5 milligrams theoretically, right? for 5 milligrams to move my THC needle out. Ooh, I'm like, wow. I was really surprised that not only it moved my THC needle, but how quickly. Like I'm sitting there drinking this, and I'm like, I'm only halfway through the can. It was like seltzer or something. It was actually something that I had formulated myself because I was doing some consulting work and making nano emulsions. But the beautiful thing about that is that now this nano emulsion has to be stable because a lot of the older emulsion technologies, they would be able to keep the stuff emulsified, but ultimately the emulsion would settle out on the inside of the can because the can is a very hydrophobic surface, and ultimately the hydrophobicity of the cannabinoids would basically overwhelm the surfactant power in able to keep everything homogeneous. You want to think like Fresca. Fresca is very interesting because Fresca, unlike 7-Up, right? You could see through 7-Up, right? Can't see through Fresca. Why? Because the emulsifiers that are emulsifying all those grapefruit oils and other citrus oils in there are basically scattering light. It's not to the point like milk, like you try looking through milk, can't see through milk, right? But when you take butter, right? Now butter is a water and oil emulsion, so just a little bit of water, a lot of oil. You melt butter, you could see through butter, right? So all these particles, it's very important to not only for them to have no taste. So you'd like to add the taste and flavor themselves. So no taste is basically what you want to go for. A lot of these emulsions require enough emulsifier that the emulsifier starts making the stuff taste very medicinal and very medicine-like. It's got like a bitter aftertaste, and it's like no one really likes that. The flavor and fragrance industry and basically the beverage industry has worked out all these problems already. So when these industries started talking to one another, and now the beverages that are out there taste great. You can hardly taste that there's cannabinoid medication. If the beverage is done right, this nano emulsification technology, and like another thing, just for the legal aspect of it, when you take, so if you have a 12 milligram beverage like this, like your typical size soda can or seltzer can, 10 milligrams in 12 ounces is 0.0028 weight percent. So it's an order of magnitude below that 0.3% cutoff. Now, certainly, if you have 10 milligrams per container, that's a lot more than this new regulation wants to drop that to, way below that. But I guess the point is that the beverage sector now was compliant with the 0.3%, and still, again, a THC user, I think any THC user, I don't know anybody who's tried a beverage and say, oh yeah, I can't feel it. You feel it, and you feel it quickly. So the fact that it's only 10 milligrams, the fact that you could buy like a 4-pack for like $25 or something like that, seems like they're pretty reasonable. And I love the fact that the beverage sector had gotten into the big beverage supply chain, such that large beverage manufacturers were basically putting this into their stores, and Minnesota was one of the states out in front of all the other ones. But yeah, so the nano emulsions has made that possible. And again, maybe about 5 or 6 years ago, nano emulsions tasted like shit. Now the nano emulsions don't taste, you can't taste them at all, and the beverages taste really good. I'm sure anyone who's ever tried a beverage these days will tell you that, yeah, beverage technology's come a long way. The other thing, just for formulation's sake, just to sort of finish up the question, is that the nice thing about, the cannabis plant is that it's remarkably versatile in how you can incorporate into edibles. You could put it into any oils you want. So certainly there's been a lot of work that's been done just about, how you can stabilize these formulations. You can use those oils in any kind of cooking oil application within foods. It's great that also, I guess, that not just on the beverage side, but there's been a lot of work to look at, how you can use those nano formulations to get fast acting effect in foods like gummies. So if you take the nano emulsion and you add that to your gummy formulation, cook off all the water, those little micropart or the nanoparticles now are encapsulated within the continuous phase of the candy. So the candy now becomes the matrix that defines those particles. So yeah, super exciting technology that this stuff can be applied in to cannabis and cannabis products. It's great.
No, and I mean the consumer loves it because yeah, I mean a decade ago it tasted like the oil, right? That was
Yeah.
being made. Prior to that, it used to taste like the butter because that was usually the extraction or oil, you know. So yeah, it has definitely come light years ahead, but I'm also excited to see what the future brings as well, specifically around edibles and edible drinks. All right, let's try this again, Rachel. My apologies. Here you go, Rachel.
No problem. That's very interesting to me because I recently went home and visited my aunt, and she served me a seltzer, an infused seltzer. And I was so confused as to like, why did this affect me so much? And I guess you learn something new every day. That's pretty fascinating.
It's really amazing, right? I mean,
Yeah,
I was blown away. I'm like, there's no way that I could feel it. I've only
yeah,
drinking half of that can. Holy shit, this stuff really works.
yeah.
Yeah,
That's exactly what I felt too. So
cool.
my question is about we're seeing an explosion of interest in the minor cannabinoids. Which one do you believe which ones do you believe have legitimate therapeutic potential and which are being overhyped by prematurely prematurely commercialized?
Oh, that's again a great question. I think Rachel, if the cannabis plant teaches us anything, the cannabis plant teaches us that it's not just about a single ingredient. It's about the full broad spectrum that the plant brings. And the other interesting aspect is that when they were doing the clinical studies for Epidiolex, where they were just looking at CBD alone, what they found was that the CBD caused, in some cases, in some with some patients, elevation in liver enzymes that were sometimes alarming because a lot of these patients are also taking other medications, and how those medications are metabolized by the liver can often create, difficult to deal medical situations. There's drug interactions, and certainly how patients can, you know, interact under two different drugs, let alone three different drugs. I mean, I myself, I take a statin and a blood pressure medication. So, how does CBD react with that in the liver? I don't know. How do these two things react? And a lot of these things we just don't know. I think that's why they call it practicing medicine. But the minor cannabinoids, I hate the word minor. I call them the other cannabinoids. Minor to me, it's like the minor league baseball team. It's just gives this like unimportance to them. I think that's part of the importance of the cannabis plant is that if you were administering full spectrum CBD to those patients, what they know is that the minor cannabinoids, including THC in those high CBD varieties, help normalize that effect in the liver. So they see that with CBD isolate, but they don't see that with CBD enriched extracts. And what we know too is that the whole plant extracts with the minor cannabinoid profiles that are in there, so CBG, CBD, and everything else that's in there, is that they have better efficacy than the isolates alone. So I think again that plays to what Ethan Russo and Dr. Mishulam had developed around the so-called entourage effect. I like what Lester Grinspoon called it, right, on Hash Church, the ensemble effect, where these molecules all are part of this active ingredient formulation, if you will, and by themselves they don't have the activity, but when they're all put together, you really see that activity. Now, I think part of your question, Rachel, is like, do those other components, other than say delta 9 THC, kind of like the star of the show, I guess. Like if we were giving out the Oscars, wouldn't delta 9 THC get it? So um, everything else, so all the other minor cannabinoids, like so what we know now, like with the cannabinoid acids for example. The cannabinoid acids have their own pharmacology independent of CB1 and CB2 receptors, right? Because the acids don't really bind to the receptors, or they have very, very low affinity to the cannabinoid 1 and cannabinoid 2 receptors, which are the central receptors of the ECS, right? But what they act on are PPAR gamma, which is a very important target for a variety of different reasons. They also act on the TRPV1 channel. So there's a variety of other biological targets that these so-called minor cannabinoids act on. I like this work that shows that CBG has all kinds of, and now there's work from that guy down at in Florida, I forget exactly where he's at. Pradeep, what's his last name? Anyway, he's done some great work with CBC, and there's been beautiful work done by Shiksa Gallo on CBG and its ability to control prostate growth. There's been work done to show that CBGA shuts down a very important anti-inflammatory pathway, a calcium channel that goes into the cell that results in release of pro-inflammatory cytokines, which if it's blocked, you get reduction of inflammation. So it's just, there's just such a rich opportunity that all these other molecules, and these are just the natural molecules in the plant. Now insert a chemist like me. Now what I'm doing is I'm taking those molecules from the plant and making new compositions of matter that we'd like to begin to probe as pharmaceutical leads for future medicines, because we understand how important the biological systems that these compounds act on are. So there's just a wealth of opportunity around the so-called minor cannabinoids. Do I think they should be sold as individual isolates or meant to be like a standalone product? I'm just an advocate of full plant extract medicine. I guess I'm a fan of isolates. I think that we have to be careful with isolates, again, because I think isolates are less tested than whole plant concentrates. But I think the minor cannabinoid market that exists from hemp and from other synthetic chemistry, I think I'm an advocate of plant derived for human consumption. I think the synthetic stuff is still something that's a little bit far off, and we need to understand what the safety of all the synthetic versus natural stuff is. I hope that answers the question.
Yeah, it seems like full spectrum is probably the best way to go if you have
I think so.
different.
It's the safest way to
Especially,
go. Safest,
yeah,
most well tested, and yeah, I mean, could you get too high and end up on the couch and miss tomorrow at work? Well, again, remember when you consume cannabis by eating it, you're administering it in a very, very different way than if you're pulling a bong rip or ripping a vape pen, right? If you're ripping a vape pen or if you're pulling a bong hit, you're mostly getting those cannabinoids into your CB1 receptors, into your central nervous system, and into your brain. When you consume by eating, it goes into your stomach, and from your stomach, it goes into your liver and then into the bloodstream. And now you have a lot of cannabinoid metabolites that don't make it into the brain, but now they're acting on your peripheral cannabinoid system, which is your CB2 receptors, which are located all throughout your body. So again, that guy who had to take tomorrow off of work, right? He ate the brownie and now he's just passed out on the couch. That might be it, Rachel. I mean, just I always recommend, especially with vets, especially with people on other medications, start low, go high, titrate yourself. Learn that you could always take more, but you can't take less. And with edibles, you always got to remember there's going to be an hour, sometimes 2 hours, depending on what you ate and depending on your metabolism, before you really feel a psychoactive type effect.
As
one.
opposed to
Sorry.
inhaling, right? And you feel it usually within 10 seconds, right?
Instantly. And
So,
you feel the euphoria and the bliss
right.
that's associated with it, as opposed to the I can't move off the couch
And I
high,
think
right?
that's the misconception to those who are doing edibles because they usually have smoked cannabis, and so they expect an immediate or quick response, but we've known for generations what happens when they don't realize and go too far. All right, looks like we got three follow-ups to that one. Nate with the first follow-up.
So to add to the complexity, terpenes are now people are becoming more aware of terpenes. But I came across an article of three things. I hope I pronounce them properly: fish sulfur-containing volatiles, esters, volatile aroma modulators, and flavonoids. Have you experienced with any of those three? And how does I know you plant. I'm with you about whole plant, but how are those smaller things that aren't cannabinoids interact with all this?
Yeah, that's great point, Nate. Is that again? There's a polypharmacy going on in the cannabis plant, and like you mentioned, terpenes, terpenoids, the volatile sulfur compounds, the esters, the aldehydes, the short chain hydrocarbons, all of these compounds, the flavonoids. I think you also mentioned. Flavonoids help give cannabis and cannabis products its color because flavonoids are highly colored, and flavonoids are very important antioxidant molecules in your diet. And terpenes are the same terpenes that are in all Mother Nature's plants. So whether it's pine trees or lemon trees or orange trees, why would Mother Nature make a different set of terpene and terpenoids for cannabis than the rest of the plant world? No, those are ubiquitous throughout the plant kingdom, and it's just great to see in cannabis the variety that the breeders have really been able to explore in terms of different flavors and different essences, and groups like Abstracts and other people who are basically figuring out these profile of these volatile sulfur compounds that are in there in such small quantity, but our nose has got the olfactory spectrometer going on, and it could sense those things even at very, very small quantities. That's an evolutionary strategy that we adopted as humans because you had to know how to smell shit. If you didn't know how to smell shit, you were probably weeded out of the gene pool, right? Anyway,
Right. Good old Skatol. All right, Leslie.
right.
Yeah, Mark, something that caught my ear is you mentioning that you have this feeling that whole plant medicine is safer than isolates. And that is something, I like to think is true as well. And I've always thought that maybe it's because the other compounds, not only do they act as in the entourage assembly aspect, but also as buffers going through the different biochemical pathways. And, because there's
Yeah,
complexities in the pH in the body and all.
that's
And I
right.
was wondering if that's something that you also believed, or if you could also expand on why you think whole plant medicine is safer.
Yeah, I mean, there's just a certain balance to this stuff. It's got it's got something that as a chemist for me is difficult to recreate. Just exactly what's going on there, right? And even the most sophisticated chemist, I mean, I think you'll be fooled into thinking that, oh yeah, we could, take a sour diesel profile or a lemon diesel profile and look at the two on the GC, determine how they're different, and then go in the laboratory and then mix a bunch of chemicals together and try to recreate those and try to convince our nose that these two are the same thing as these two, and they never are, you know. And the cool thing is again, I always liken the terpenoid aroma to the orchestra, where you could certainly recreate an orchestral piece of music with a string quartet, but it won't sound as full bodied as the entire 88-piece orchestra. When you're sitting in front of that orchestra, think about it. Violins are three deep, right? Right. Horns are three deep. You're hearing the top notes, right? But there's this essence that's underneath it that really supports it. And I think that's the most striking analogy to cannabis is that, yeah, we know what we see. We could look at a terpene profile. Guess what? Beta caryophyllene, limonene, myrcene, and we have nerds like on Hash Church like Ryan, right, ATN, who will go in the weeds and will tell you exactly what cross and what phenotype and who's grow and selene diene and all these, and we do get into the weeds when we're just looking at first trumpet and we're not going down into that full bodiness of the orchestra. And so I think that cannabis has really got this huge thing going on that is never going to be able to be teased apart into the individual components such that it could be recreated. I just don't think it can. Now, again, maybe I'm wrong, but
I think we're always looking at first chair, right? That's what we're
Yeah,
doing.
that's right.
We're always analyzing first chair. I
Yeah,
think on Ash Church is definitely one of our notes that we pull on for sure. All right, Michael Crowitz, your questions next.
Thanks, Etienne. So our council took notice of the fact that you're a federal court certified expert, and I think
yes.
it inspired us to ask you this question because hopefully you could be sort of impartial and give an answer. That may or may not favor one or another entities out there. But we're talking about drug testing and cannabis testing, not drug testing like urine testing, but cannabis testing, and the two sides of it. So I want to first preface that, like, we have problems with cannabis testing where there's somewhat of a conspiracy sometimes to come up with the numbers that they're looking for, or that kind of stuff, or and then the other thing that we've run into a lot is people basically trained to buy cannabis based on testing, based on the THC number, and that may mean more to like a vape pen or an extract, but to the flower it seems very misleading, and it seems to steer people away from cannabis that they might like better, in our opinion. If they were able to smell it, ironically, going back to your answer from the last question, you're not allowed to smell cannabis. The more legal it is, it seems like the more sealed up it is, and the harder it is to actually access the cannabis to smell it. So, relying on this testing, and then the question comes from that: what are the biggest weaknesses that you see today in cannabis testing, and how do these weaknesses affect consumer safety, especially medical users like veterans?
Yeah. Well, you bring up a great point, Michael, and there's so many aspects to testing to address. First of all, and I know, and any good deadhead will tell you that it's never just about the THC percentage. I mean, I don't think like back in the day we were so concerned about potency. We just knew that it tasted good and it got us high, right? It's like we did our own bioassay, as Bubble Man would say, right? And I think at a certain point where testing becomes important, especially around THC, is you got to recognize in a commercial marketplace that if you're growing for oil, THC concentration is going to correlate with trichome density, right? So the more potent your flower material is, whether it's whole buds, trim, larf, whatever. I mean, if you're talking about doing cannabis transactions at a large sale, and you're growing for oil, and say you're selling to a processor, right? And the processor is going to extract that material and turn that process into vape pen carts or whatever. To them, THC concentration is what it's all about, right? Because for them, they're going to buy material that's 20% THC versus 10% THC, and you know what they're going to get in terms of the returns. So it's kind of forced into that way because it's a commercial marketplace, and certainly these companies, a lot of them are struggling for profitability, and you're in a commodity marketplace where sometimes you're competing against not only the illicit market, but now the hemp market too as well. So it becomes very important for these producers to be able to, dial out their costs. And certainly if you're going to be growing material, I mean, you want to grow for oil content, especially if you're going to be making concentrates. So, again, I get it, the dispensary purchase, right? The psychology of that purchase, right? When you're in the dispensary and you're looking at the nice aquarium and the couches and all the accessories around there, you know that you're paying for all those nice things at the dispensary. I'm going to get the biggest bang for my buck. What am I going to look for? THC content, right? It's got, more oil on that bud. That doesn't mean that's going to get you more high. The other material that tests for 14% might get you as high as the stuff that tests for 24%. But the stuff that 24% is priced at this and the stuff at 14% is priced at that, I might buy the 14% stuff. At the end of the day, THC content does matter probably to the dispensary buyer. Does it matter to the buyer at the Grateful Dead show at the parking lot? No. Tastes good. It gets me high. It's from NorCal. I want it, right? So other aspects of, you mentioned, again, just talking about safety in particular. I mean, again, where cannabis is often problematic is where there's either unintentional dosing. I think there's been cases where either kids are getting their hands on edibles or material is made that's dosed that wasn't known it was dosed, and then a bunch of people got sick. Other aspects around testing is, part of it, Mike, that really bothers me is the whole ambiguity of the law itself, right? Like they danced around this issue of THCA and THC in the Farm Bill, right? Like it could be interpreted that, they only care about Delta 9 THC. They don't care about THCA. We all know that the cannabis flower makes THCA, and when we smoke it, it thermally decarboxylates it. So I think there's issues with, like the DEA will use gas chromatography again because I think their method assumes that all cannabis is smoked. If all cannabis is smoked, it's perfectly fine to heat it up when you test it. But if you're trying to make that argument of, it's THCA and not THC, well, their method isn't going to discriminate on that. So I think they need to tighten up a lot of the regulation around that. Hopefully this notion that the president moved things to Schedule 3 will address some of these issues. I'm not sure it will. But I think the other thing that I see is that right now, currently, we have this patchwork from state to state of laws that aren't consistent throughout the country. And so that does create problems in terms of commerce. It creates, things where, things can cross state lines because you can make an internet purchase. We can go to an internet site right now and 2 clicks after you say you're 21, it's asking for your credit card information for stuff that typically you would need to go to the dispensary to buy. So I think there needs to be some harmonization of the laws and how regulation is basically governing this thing as so-called one plant and not 2 separate markets, because one market is more regulated, more, in fact, what was found in Canada anyway, is that regulated material was a lot cleaner, even though THC levels weren't always necessarily what were written on the labels. They didn't have the pesticide, heavy metals, or microbial contamination that stuff from the illicit market had. That was just one study that was published.
All right, Mike has a follow-up.
Yeah, I've followed up on that. It's fascinating to me. Combining this together with our discussion on hyperemesis, it strikes me that the regulators find themselves in almost a lose-lose situation where they might think, well, if high THC and high dose cannabis is what is at risk here, then we'll minimize how much you can buy and we'll minimize how much THC is in it. And I can tell you from Drug War 101 that what that will do is send more people out to get products that will wind up being stronger than what they were already getting. And so it's like their cure is most definitely going to be worse than a disease unless they find out what they're doing and understand what they're doing. But then that brings me back to you, and I say, where do we, how do we hold that? What do we do on that line? Basically, the conundrum is this. Like I was saying, you can't smell the herb. There's no real facility for you to be able to smell the herb. At least right now, across the board in every state, I could say with a certain amount of confidence that the consumer is trained to buy bud flowers based on a THC number.
Yeah.
And together with just a little bit of habitual, hardcore use, and you've got the recipe for disaster. What from your perspective, what does a regulator do?
Yeah, I mean, to me, it's not completely unsimilar to alcohol and ethanol. Like, if you think of it like this, Mike, right? Like, vineyards don't produce um, ethanol, right? They produce wine, right? Which is a handcrafted product, and uh, and they don't produce grapes, right? They grow grapes. It's like weed, right? You grow weed, you process it. I guess again, just thinking about being a concentrate consumer, I want the whole plant goodness with no human like if it's golden on the plant, I want it golden in the jar. You know what I mean? Like I don't want humans to alter my medicine in between the plant and the jar. But I think that where things can go wrong is when people just assume, well, in that 12-ounce beverage, I don't need full spectrum extract. I just need the THC molecule. And if you just need the THC molecule and you're in a commodity business, low cost is going to win all day long, you know? And so the cheapest ingredients you could put into your beverage, the more profitability your company will make. And, you know, I don't know, call me a purist. I liken it like to the microbrew kind of moment, you know? I mean, certainly you can go to the Walmart and you could buy Budweiser or any other mass brew swill like that. Or you can go down to your local microbrew pub where you know the brewer and you could smell what's being brewed that day, and you could sit down at the bar and talk to your neighbors and throw a pint back. You know, com- compare the experiences. I don't know. I mean, again, way I think about cannabis being a quality product that's handcrafted by humans, and I think the best cannabis I've ever had. I know that like the humans that have grown that and produced that put their love into it, and you could just see it in the plant itself, and you can't see that in a beverage, can't see that in a gummy, can't see that in a vape pen, but man, you could see it in the flower itself. And call me a sucker, old school. Again, like to me, the whole plant is the best medicine that's out there right now. I want the least adulteration of what the plant is producing into my lungs or into my being. And I don't even know if I answered your question. Did I answer your question?
I think so. I think that yes. Nate has another follow-up.
What's your opinion? Right now, all the lab testing is done by private entities that have a financial interest. What would you say to bring more standardization and more level playing field of having testing done by the state and not by private companies?
Yeah, it's a great question. It's a great point. It's difficult to make money in the cannabis testing business because, especially in markets where multiple testing labs open up and producers can do what's called lab shopping and find the lab that gives the best, quickest, and perhaps dirtiest results. Being able to sell your flower is all predicated on having clean COAs and clean testing results. And if one lab gives you clean results and the other lab doesn't, and there's no switching to another model. Like you mentioned, Nate, about state testing. They tried that in New York, and what they found is that the state lab was getting backed up. They ultimately, I think, had to open things up for private enterprise to do testing. Look, third party testing happens all the time in consumer products and food products. There's third party testing that do quality control testing here at the dairies in Vermont. Certainly, any place that's producing stuff for human consumption, there should be inspection of those facilities. Um, I think what's really funny is that cannabis always gets the black eye for this. There's a lot of I won't call them clean, but maybe semi dirty industries out there where if you applied the level of rigor, Nate, that we apply to cannabis, to say like the produce industry or the other industries, you'd be surprised at what you'd find. But, ultimately, I think the cannabis industry has to grow up with third party testing because the consumer requires some type of level of quality assurance testing that's not just done by the manufacturer because the manufacturer's got a dog in the fight, right? They're trying to sell their biscuits, right? But, other people should be testing those biscuits and making sure that they're safe for human consumption. That's one thing is they'll test, cannabis products for cannabinoid content and raise a big bugaboo if they're okay by cannabis content. But you look at some of those perishable foods and they're not edible just because the food is no longer food. I mean, cannabinoids might have a longer shelf life than some of these foods, and certainly the supply chains aren't there to always exist that to talk about freshness of food. So, yeah, I think that there's other, growing pains that the cannabis industry is going to have as it grows up, and I think testing is going to be one. But ultimately, I think legalization will level the playing field, and food companies and producers who are used to GMP level production and testing will be able to make sure that cannabis products are safe that are being mass produced and sold.
All right, let's get to Mike D with our next question.
Yeah, Dr. Mark, finally good to meet you. I see you on Hash Church all the time. So
Nice to meet you, Mike.
yeah,
Where are you from, buddy?
Deadhead originally or
No,
like
where are you from now?
oh yeah, I live out here in Sacramento. I live close to
on.
PN, yeah.
Right
So
on. Cool.
yeah,
Nice
you're
to
a
meet
Brent.
you.
So you're a Brent fan?
Yeah, well, I cut my teeth during the Brent years for sure.
Oh, that's cool, man.
I saw
Yeah.
a couple hundred shows.
Oh, that's it. No.
Yeah, that's it. I wasn't in California. I was, we had to
Yeah.
travel.
Yeah, my favorite Brent song is the 7789 show for Blow Away, man. That's like
Oh
yeah.
yeah, yeah, yeah. Your what is your rib cage a jail cell? Is that one right? We're talking about his heart beating.
Yeah, yeah,
Everyone
yeah,
hold your heart up, and
yeah,
is your rib cage a jail cell for your heart? Yeah,
yeah,
yeah.
man.
He was incredible. I was at his last show, about 13th row, 14th row at Tinley Park, and yeah, it was real sad. Him and Jerry really had some onstage chemistry to behold. They were really. Jerry would get so excited when he would come over and look at Brent, and Brent would just be going crazy behind the keys, and Jerry over his glasses there would just look at him and crack a
Doing that little
smile, and
smirk, yeah.
yeah, so fun, man, so good. We had it so good, Mike.
I know, I know, I know. It's so sad with the passing of, Bob. This few months ago it was wild. I was just in well, we shouldn't talk about this stuff right now. We're doing other stuff, but we'll talk later, I guess, or something.
Sure,
Yeah, we'll do dead stuff or something. But
absolutely. Reach out.
yeah, my question is, where should the industry draw the line between acceptable chemical modification and products that no longer meaningfully represent cannabis?
Yeah, well, I mean, geez, that's an easy question to answer because I don't think anything chemically modified should be out for human consumption. I'm a big advocate for whole plant and high quality access of everyone, in particular veterans. I'm not a veteran myself. My dad and my uncle are both veterans. Are still alive. Um, uh, I think veterans need access to high quality cannabis and cannabis products. In fact, it should be it should be given to them. They shouldn't have to pay a dime for it. It should all come free from the government to veterans for the price that they paid for giving up a portion of their lives to defend our countries and our freedoms that we all enjoy. And so I, for one, am very, very grateful for all of you for the freedoms that I enjoy. Uh, and part of my way of giving back, again, is educating people in cannabis science. And I have students in my laboratory who work for me, and we're doing research. And yes, I'm affecting the minds of tomorrow by educating them today. And yeah, it's really like, chemical modification is a really interesting topic because for me as a chemist, I want to do that. I want to take the compounds from the plant and I want to tweak them, but then I want to do safety and efficacy studies before I give them to humans. I'm not somebody who's like, oh, okay, these are plant derived, so if I chemically modify them with some type of chemistry, they're still plant derived, so they're safe. No, as soon as they're plant derived, you change them, and we don't know what they're going to do. And until we know what they're going to do, we can't ethically ask people to basically consume them. So I'm one who really believes in that. The cannabis plant teaches us several things, and one of the things it teaches us is that there's a brotherhood and a sisterhood around this plant, that we should make this plant available, and we should teach this plant and teach our children how to grow this when they're at the right age, teach them how to grow and teach them how to produce. You get such a wonderful experience because the plant teaches you so much. The plant will teach you what it needs, what it wants, and ultimately it provides you again with this thing that you've been able to produce. And it's a crime to me of our government that we are restricting access to cannabis, especially to veterans and especially to special needs people and people with medical conditions where cannabis can help them. If cannabis can help them, it should not only be lawful, it should be recommended before doctors recommend FDA approved drugs with their litany of side effects that feed billion-dollar corporations. It's a powerful thing when you can grow your own medicine, and we should all be allowed to grow our own medicine. And when we could produce our own medicine, guess what? That's less money for those other big companies. Now, again, I'm a chemist, so I'm interested in exploring the chemical modification of cannabinoids because I'm interested from the standpoint that, hey, here's what Mother Nature provides to us. Maybe we can build new molecules to create new cures for cancer, not recreational products. The cannabis plant provides us with everything that we need as humans to enjoy. But if we could turn one of these molecules into a cure for cancer or into a cure for ALS or a treatment for Alzheimer's or neurodegenerative diseases, and the endocannabinoid system and the phytocannabinoids teach us how to do it. I'm one of the first, not one of the first, but I'm one of many chemists who think, hey, the cannabis plant teaches us that these molecules are the active ingredients. What if we do subtle chemistry to these molecules to turn them into other molecules that could be essentially cures for cancer, like I say. So I'm all about chemical modification, but not for immediate consumption and use by recreational market. The cannabis plant provides us that, Mike. And so what we need is we need a government who supports getting access to cannabis and high quality cannabis products for the entirety of our population, but most certainly to our veterans.
Thank you for that. All right, I have the next question. So, what does chemistry tell us about the disconnect between the cannabinoid presence in the body and the actual impairment? And how should that inform policy, especially for veterans in safety-sensitive roles?
Well, that's a really, really good point because, certainly, I mean, and I get some of my information from people like you, Etienne, who tell me how difficult battle was. When you're in battle, and at any moment, you could be next to somebody who gets shot, or you could be shot yourself, or your whole platoon could be blown up. I mean, to have to live with that level of stress, I mean, if anything, cannabis provides a relief for that kind of stress. So, in a way, I believe our service members, maybe during their off hours, maybe when they're not on patrol, should be able to consume cannabis, should be able to use its ability to, reduce anxiety. I mean, I could think of no more of a anxiety ridden position to be in, not knowing whether or not you're going to live or die. And that it doesn't just leave you at a snap of a finger, does it, ATN? That sticks with you, right? And so, yeah, so certainly there is a disconnect, I think. The disconnect that exists in some cases, especially I hate calling it D. I just call it post-traumatic stress. It's not a disease, post-traumatic stress or disorder. It's just dealing with stress from an earlier incident in your life where you have to be able to, again, forget about life for a while. What does weed do? Smoking cannabis, it helps you forget about things, right? As it turns out, evolutionarily speaking, that's actually a good quality to have, right? Because if you remembered the face of everybody that you saw every day of your life, your head would explode. And what ends up happening, again, ATN, is I believe, again, how we could use this in not only active service. I mean, to me, it's like, yes, do I want a tank operator or somebody who's flying aircraft maybe high on cannabis? Probably not. Probably not. But that pilot or that tank operator is going to have some downtime or maybe even some family leave time. At that time, they should be allowed to consume cannabis. They should be allowed to all the freedoms that they help fight for. But certainly, like in a high stress, situation. I mean, just like you wouldn't want your heart surgeon who's about to do heart surgery on you to probably just come in from pulling a couple dab rigs or hits, but perhaps again, society, when it destigmatizes cannabis, it won't be viewed as such a negative thing that, yeah, you know what, the tank driver doesn't need to be high on cannabis while he drives the tank. You know why? Because he's looking forward to blowing off some steam with his buddies later over a joint,
No, great points. All in all. Council Member Landau, you're up with the next question.
Second, how close is industry to achieving true pharmaceutical grade consistency in cannabis products, and what scientific hurdles still need to be overcome?
Yeah, well, again, when you say pharmaceutical grade consistency, pharmaceuticals are typically only a single active ingredient. In some cases, they do have multiple active ingredients formulated into one pill, but in most cases, it's just one active ingredient per pill. So, again, Nate, this goes back to what we were saying earlier. The cannabis plant teaches us anything. It's not about one active ingredient, it's about this polypharmacia of active ingredients. In fact, some of the compounds that you had mentioned, like flavonoids, I mean, the flavonoids and cannabinoids and terpenes and volatile sulfur molecules and these esters and these aldehydes, all of these play this music together that when we experience whole plant medicine and when we open up that jar and we look at that high quality extract or water hash, right? And you're like, yeah, this is God in this that's my image of God is what this is. And that is beautiful, untouched medicine that is golden in the jar as it was in the plant. And so I think as humans, we're custodians of that process. Pharmaceutical grade, I don't think is a term that should be applied. I think what we ought to apply to pharmaceuticals is what's cannabis grade, right? It's kind of like they almost have to take a lesson from the cannabis plant that maybe more pharmaceuticals can be more beneficial if it were multiple active ingredients, kind of like a whole plant type of extract. But it's a really interesting point because I think part of what the pharmaceuticalization of cannabis would involve would be to make a more standardized product, a product that no matter whether the plant is tall, whether the plant is small, whether the plant is, what variety it is, it's still the same consistent product, harvest and harvest again. And they've figured out how to dial out the things that make, you know, product specification people go crazy because, you know, how do you put product specifications on a plant that's different every time, right? So it's sometimes difficult to do that when you're talking about plants because plants do have this very, very different behavior than just thinking about a single active ingredient like aspirin, for example, right? Aspirin is just a synthetic molecule. It's the only active ingredient in that tablet, or ibuprofen. It's the only active ingredient. I think like Anacin would have like caffeine and have aspirin there in the same tablet formulation, and the caffeine helped. And I know that there's some other ibuprofen where they stack a little bit of what is it, codeine and ibuprofen in the same thing. But I think that there's still a long way to go before you get medicine as effective as cannabis with as many different components in cannabis. How you could pharmaceuticalize that and make that into a pharmaceutical grade product, good luck. I hope that answers your question.
Nate's got a follow up.
Yes, it did. I came across this company called Cannabis where they take your point and they do something else. Is through saliva samples and machine learning, they're able to find genetic markers. So they have a peer review paper on it. What they did is they took a control group of children without autism and a group with autism, and they showed the aggression is one of the marks of autism, and they showed 90 minutes after the kids with autism took cannabis, their aggression levels were the same level as kids without it. So they're trying to take the back approach, like, yeah, there's so many differences. Let's actually measure the actual effect on human bodies instead of trying to fit the cannabis plant into a single capsule. So, yeah, you're right. I don't think there's any way where it's just a pill where, hey, you have bronchitis, you take this pill and you get better. I don't know if we'll ever get there.
No, I think that there's multiple. You bring up a very interesting discussion, which is that cannabis, to me, and the phytocannabinoids, act more like vitamins, and so to me, this is more nutritional. It's more about like a nutritional input, Nate. In fact, this relates to an earlier question where I think this was Etienne's question about the endocannabinoid system. You know, the endocannabinoids that are in our body, at least the two that we know about, 2-AG and anandamide, those are derived from a compound called arachidonic acid. Well, arachidonic acid is a polyunsaturated acid that's a membrane component that's part of the arachidonic acid cascade that leads to molecules like prostaglandins and leukotrienes and thromboxane and a variety of different things. In fact, cyclooxygenase, which is the target of many analgesics, cyclooxygenase 2 is along that pathway. And so the reason why this is important is because arachidonic acid comes in from the diet, right? So a diet rich in polyunsaturated acids, again, is kind of feeding our own endocannabinoid, processing center, if you will. So I think, Dr. Russo and others have sort of characterized certain medical conditions and certain disease as endocannabinoid deficient. Well, maybe again, if you have a diet rich in these polyunsaturated acids, now your body is able to make those endocannabinoid like molecules that basically help maintain homeostasis within the body, doing it completely naturally, right?
Mike D has a follow-up as well.
Yeah, I'm still on the pharmacology kick. I have a couple questions. We're talking about pharmacology and we're thinking in terms of, trying to determine, whether it's plant medicine or, I don't know if you've seen like the little rosin not gummies, but
Hmm.
like even they have like pills now, right? So like little
Right.
pills, and I've had some of those, and I don't know if maybe you can even explain like how those interact, if they interact differently than, say, like a little edible. But my point that I'm trying to make and illustrate, which you even said, hey, good luck if you're trying to, make like a standard, right? Because the plant does express itself in different ways, right? And it's hard to kind of just create, a same standard. So, I'm thinking more long term, right? Like Schedule 3, FDA, like approval and have them trying to, actually issue medication. And, what does that kind of look like and have to be grown either in like a lab? Like, how difficult would that be to, for someone to go to a pharmacy and say, or for doctors to prescribe medicines and finally get to that point where it's like, okay, well, now we understand that like your endocannabinoid system prefers maybe like a gelato strain, or maybe your endocannabinoid system prefers, this type of rosin instead of, this other type of rosin,
Right.
the same way that they just throw pills at us veterans until something sticks, right? I mean, that's kind of
Right.
what cannabis is all about, right? Trying your different terpene profiles and to determine what works best with our endocannabinoid system. So I guess it's all very complex, and just trying to, if we're gonna get there and get to, descheduling and get to that platform eventually, like, man, is it a wild thing, So, but also like the rosin tab things, if you have any insight on those and how they kind of
Yeah.
affect differently too. So I don't know, just
y- Yeah.
sorry, it's a
So
lot.
no, 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 no. I love the discussion. 18. What I'm thinking about was the conversation that Marcus had on Hash Church, either last week or the week before, where again he was skeptical going into this whole rosin gummy thing, like, oh, this is gonna just taste like weed and not get me very high. But it moved his THC needle. I've never had a rosin gummy, but I know people who have had them, and they say, yeah, it's a different experience. It's not just putting like distillate into your gummy formulation and having a little THC in there and moving your THC needle. So again, what that might speak to, Mike, is this entourage effect of what's in the rosin and ultimately what's in the bubble that the rosin came from, and ultimately the plant. So you have the plant, you have the bubble, you have the rosin, and now you have the gummy. It's like, um, I'll get biblical for a second. Fruit of the vine and work of human hand, right? So, so without humans, I mean, so certainly like the humans made the selection of the variety. And that's what's so beautiful is that we have those nerds that we were talking about earlier, like Ryan and all the other breeders who have really taken this plant to whole new dimensions in terms of flavors and profiles. And I think the flavor and the terpene profile, to me, I mean, it's like known that these things are monsters for THC, right? It's almost like, I hate to say this, you almost want to get the THC out of the way, right? Because it's almost like it's kind of like the Mona Lisa, right? Like when you look at the Mona Lisa, you see the woman there, right? But you almost need to take the woman out of the picture so you could see the rest of the painting, right? And you almost have to do that with THC and cannabis because, yeah, do these things get you blitzed? Certainly. Like I've walked away again from certain hashes, certain like really nice rosins, and I'm like, whoa, that just I have the taste of the plant just fired up in my mouth. Not only am I high, but I have that taste and that flavor that really shows that every step along the way, from the cultivation to the bubble to the rosin to now the thing I just pulled. I mean, I don't have experience with the rosin gummies, but I would like to believe that that same experience at the next level, putting this into an edible or putting it into a soda. I'm not crazy about making my fruity cannabis into like a soda or you know what I mean? Like I want my sodas to be sodas and I want my cannabis to be cannabis. To me, I like seltzers because first of all they have no sugar, and seltzer you really just have the nakedness of the carbonated water and the flavor and the cannabinoid, right? So there's no place to hide there. You can't, oh, I'll just throw a bunch of sugar in there and the sugar will just take care. It's like, no, you're basically carbonated water, right? Flavor, right? And if you're drinking like, I don't know, strawberry seltzer or lemon seltzer, whatever, right? And then that's it. And so the stability of that cannabinoid nanoemulsion that we were talking about earlier is really super important for that. But I guess the other thing again is like how our body experiences that. So now I'm drinking, a fruity strawberry or lemon flavored seltzer. I like the way that tastes. And oh yeah, after half the fucking can, it moved my needle. I'm like, I'm in a nice spot. Like I'm in the middle, I'm at work. I'm just having a seltzer and it's like, holy shit, there's no cloud of smoke. I don't smell like weed, right? So, but, where did that THC molecule come from? So that's probably a whole different can of worms there. Anyway.
And onward we move. Next will be Leslie Freeze with our next question. Leslie. Oop, oop. You there? There we go.
Hey, I am. Sorry about that. Um, what has been your involvement in the past decade in educating people about synthetic cannabinoids and their dangers?
Well, that's a great question. I've given talk on the other cannabinoids. God, where was that? That was a couple of years ago at one of these cannabis conferences, and I can't remember which one off the top of my head. I'm sorry. I should have done my homework. But yeah, I'm a college professor, so I'm involved in education. Excuse me. Educating is an important aspect of who I am and what I do. Um, I believe that again, there's a lot that can be done to make sure that the truth is out about this plant and that the hypocrisy and the stigma are addressed. The government has its own, or had its own, I guess it's expired now, patent on the neuroprotective properties of cannabis. Meanwhile, they were saying there were no known or accepted medical use when they had a patent on the neuroprotective properties of cannabis, which I believe they actually licensed out to a small company and collected licensing revenue on. So I think it's important to make sure that Professor Mishulam's work continues, and I'm inspired by him every day. I never met Professor Mishulam, but we had several email correspondences while he was alive. And I think he respected me because he knew that I was a good chemist and we talked about chemistry all the time in emails. And what I could say is that I think he knew that this was only going to go so far and that we really needed to make the plant more legitimate in terms of its medical use and utility. And I think part of his frustration and the other frustration of cannabis researchers is that we're still tarred with that same, stigma and that same, notion that somehow we're just working on medicine that gets you high. When, I just submitted a grant to the National Institute of Health asking for a whole lot of money to study the anti-cancer and autoimmune disorder effects of cannabinoids. And so I think we all know that the cannabis plant is like this beautiful thing that we need to make sure that we grow up, future generations, not fearing it like the other generations. I mean, my kids grew up in a weed smoking household. I did not grow up in a weed smoking household. It was different for me growing up. So I think it has to be endorsed and the stigma has to go away. And I think it needs to be dealt with, especially if you're raising kids and you're bringing kids into this world and you're trying to mentor and educate children. I mean, there's certainly lines that have to be drawn. And I think there's certain aspects of our educational system that certainly has to inform not only about the history of the plant, but the history of the, quite frankly, government hypocrisy against the plant. So I'm involved in that as much as we can be. I mean, 18 and I have been stalwarts on Hash Church for a long time. I think we're recognized as sort of people who are at that front end of the movement who can maybe act as mentors and examples for younger people and to say, hey, I can look at ATN and I could see myself in that role in the future. And that's what I'm going to do. I'm going to be an advocate for veterans and I'm going to open up a dispensary in my town. And maybe for me, they would get into science. Um, I think we need more scientists who are educated on the cannabis plant and more people that know more information about this plant so we can, again, carry on the work of Professor Mishulam and others. I feel honored to be in this position. Thank you for the question.
Yeah, it's a privilege. We worked ourselves into these by just doing the right things and trying to educate people and push them in the direction of educating themselves, right? Because there's so much to learn about cannabis than what I think we learned in our smoking circles that I've unlearned more for sure, and I've definitely it's the wonderful. Always at a new frontier, but let's move us along to the next question, Rachel. You have the next question. You're recognized.
Thank you so much. This has been really great, and it's actually really nice to see that the science backs up what my instincts have always been about. But leave it alone, basically.
Yeah, it's good the way it is.
Right. So I have a question. It's what are your thoughts on the current extraction methods, and is there one method that's more medically beneficial than the others?
Yeah, I mean, I think Atian, am I correct? We are purists for solventless hash. I think Bubble Man has made a winner out of all of us. If you think about it, if you're in that real commercial production area, you're probably going to be doing solvent extraction. For solvent extraction, I prefer low temperature butane or um, butane, isopropane, butane, propane, or isobutane extraction. So closed loop hydrocarbon extraction. I like those types of extracts myself. I think the hydrocarbon gives a really good extraction product, and I think it can be scaled commercially. Water hash to me is more of an artisan kind of smaller scale than solvent extraction. I see those guys going through tanks of solvent and going through lots of weed and filling their vacuum ovens as fast as they can and getting stuff out to market. And yeah, I think people have been made into concentrate consumers because of the quality of the extractions that are being made these days. Uh, but I really do think there's something to really good small scale artisan water hash and rosin production. I think rosin is just a wonderful product. We saw it. I mean, and I witnessed it happen live on Hash Church. I think there were a lot of us who were skeptical, like, oh, you're going to squeeze oil out of that? Are you kidding me? And Soil Grown did it on live Hash Church on the internet and took a bud about the size of my elbow and put it into a t-shirt press and pressed it live on the internet. And when we saw that oil coming out, we were all made believers. But I think if you look at the process, at the way it's been developed, the way it's been optimized, and the way people are really perfecting not only just from the strains and how they're cultivating those strains, but how they're harvesting and ultimately how they're washing the strains. There's a lot of human artisanship that goes into that. And so it's easy to screw things up, is basically what I'm saying. So it's easy to get, not easy, but it's very particular to get things right. And so when things are right and it tastes just like, chocolate frosting off of your mom's favorite cake, I mean, it's just, there's nothing like that in the world. And so, yeah, again, personally, I'm a fan of small scale artisan uh, bubble hash. I'm not fortunate enough to have dry sift hash. I wish. I'm friends with Cuban, but I haven't seen him in a while, and I haven't gotten some good dry sift. But just fans of bubble hash and bubble rosin. I love a live product, so I'm personal friends with Kind Bill, the guy who invented uh, live extraction or fresh frozen extraction. So the people who first did butane extraction of fresh frozen material. So I'm a big fan of live resin and just love the quality that can be made. And that way, really very, very singular can be made that way. So I would say, just to finish the question, is yeah, I love low temperature butane and closed loop hydrocarbon extracts, but I also like the single source water hash rosin too as well. That's a personal favorite.
Rachel's got a follow up. Rachel, you have a follow up?
Sorry, I thought I was off mute. So do you see like any big difference between, like, let's say RO and FICO when it comes to the medical benefits?
I didn't catch the first. So you said FICO. I heard FICO, but what did you say? What were
Do
you
you find
comparing?
like a medical difference between, let's say, FICO and RSO, for instance?
Well, yeah. I mean, no. I mean, RSO is just named after Rick, right? And he was the guy who had cancer and boiled down a bunch of weed using lighter fluid in a crock pot in his
Yeah.
garage. I don't recommend using lighter fluid. Don't recommend using a crock pot. That's just a recipe for a fire. Um, but I think what Rick, the notion of RSO is just full spectrum extract, like you call it FICO. Some people just call it full spectrum extract. Whatever you call it, doesn't make a difference. You're just extracting the cannabis plant. In a lot of cases, Rachel, when you're boiling off the solvent, you lose some of the most volatile terpenes too, and that's why when you could smell it in your garage, you could probably realize that it's escaping. And the other thing is that you'll notice that, unlike the stuff in my jar here, which is golden yellow, right? You can kind of see it, golden yellow. The FICO is usually black, usually dark, and really oxidized, and you've kind of overheated it, and at that point you've turned it into a real kind of mess in terms of the whole plant goodness. Um, so that doesn't say that it doesn't have any medical value. Certainly like a full spectrum extract um, could have medical value, but certainly there could be some off notes in the flavor and the taste because things are a little burnt. I've had stuff that's pretty weed tasting. You can kind of taste the pigment they extracted for several hours, and what happens. I mean, you don't need to extract for several hours. You can do a really quick extraction, and you'll know that if you ever get cannabis sticky on your hands, take a squirt bottle with alcohol, and initially the sticky just goes away immediately. So what that tells you is that the cannabinoids and the sticky components of the cannabis plant are no match for the solvent power of any of these solvents, even cooking oil. So cooking oil immediately dissolves cannabinoids. There's no like long time. Like you don't have to cook cannabis in a crock pot for several hours to get it to extract. It will extract pretty quickly. Decarboxylation could be something that could take a little bit longer. And I know in most FICOs, they're fully decarboxylated. So you've extracted your cannabinoid acids and you've heated it up to a temperature long enough that you've basically decarboxylated your cannabinoids. I'd like to think that the magic of the cannabis plant provides us with the cannabinoid acids, which, as I said earlier, have their own unique pharmacology that's independent from the cannabinoid receptors and act on PPAR gamma and TRPV1 and other molecular targets in the body. So to me, you almost in a full spectrum product want cannabinoid acids in addition to the decarboxylated cannabinoids. Again, you're just, it's a Jean-Luc fire all weapons moment. And so, especially if you have something like cancer, you probably want both mixtures of the cannabinoids as well as the cannabinoid acids in those full spectrum oils.
Nate has a follow up.
So Etienne was telling me about this hash that would be cured for 2 or 3 years. Again, sorry, I'm butchering what you said, but could you explain chemically what happens when hash sits like that for so long? And
Yeah, so this is kind of interesting. There's a reaction that occurs. So myrcene is a terpene that's in cannabis, and so when myrcene, which is in the outer skin of hash, is exposed to light, the light initiates a degradation reaction and turns myrcene into something called hashishene. So hashishene is a terpene rearranged product that's been photolytically rearranged. And so, yeah, on storage, what happens is the light hits the outside of the hash and causes this oxidation to occur. And what you notice too, if you ever have like an older block of hash, I have a piece over there, and every once in a while I'll scrape back a little bit at the top, and what you'll see is that right underneath it, it's much lighter in color. So certainly there's some kind of like degradation that happens on the outside skin of the hash, right? So I think that could actually be kind of like a good thing, kind of like the way cheese ages and wine ages, right? There's basically oxidation chemistry that's going on in its environment, and as the material cures, it oxidizes, and part of its flavor and part of its essence, part of its bite, like some alcohols, like scotch and whatnot, are a function of not the material that goes into the vessel, but the material that comes out of the vessel, in that case, a barrel, right? So there's something that's going on in that aging process that actually lends to, its spiciness and its behavior in terms of its palate. And I really enjoy that myself.
Right on. All right, Michael Krawitz.
Thanks, Etienne. Yeah, it's funny. In a way, I guess you've answered this question a little bit, but it has to do with something similar to what you're just talking about. It's funny talking about Rick Simpson. We were on kind of the back room of one of these podcast radio shows of Time for Hemp years and years and years ago, and I think it's Michelle Aldrich was saying something about I love what Rick's idea, but I don't suggest using
Yeah.
naphtha in a bucket. I guess at that time he was using naphtha in a bucket. I guess that's a graduated, better way to do it than the crock pot and the lighter fluid. But naphtha in a bucket, and she said something like, "You get Rick, and I'll tell him to his face." And you're gonna laugh, but Rick all of a sudden chimes in. We didn't know he was on the call. He called in. Nobody knew. He was supposed to be on later that day and had the wrong time zone because he was on the other side of the world somewhere and just happened to be in the wrong room at the wrong time, just as his name was said. And I think it's funny. But anyway, it leads into this question really well because, and one last little piece, right? In Vienna, when Austria was trying to legalize, basically trying to reschedule cannabis on their own through a resolution, they wanted to do a very focused resolution that would allow for extracts of cannabis to be moved around more easily under a different schedule, moving it out of Schedule 4, which we later did. But just for a particular range of medicines. And the company working with the government of Austria was like, one of these heavy duty, big pharma company people that, worked with the big pharma that were, off on their own doing this cannabis thing. And he told me that their preferred way of doing it was a naphtha extraction. But here, this is the question, and it leads into perfectly these stories because when isolating a single compound, does the process or method matter for the final product after a proper cleanup?
Yeah, absolutely. So anything that involves a solvent, Mike, like you think of it like this, like if you're washing the resin off of the cannabis plant with anything other than water, so alcohol or butane or something like that, you have to make sure that now in your solvent recovery that you're removing 100% of that solvent that you just added, right? And again, this is where it becomes a little crazy because when you look at like, so when you're doing solvent extraction, a lot of times, again, the solvent, the solubility of cannabinoids are instant. As soon as cannabinoids hit, I mean, think about it, Mike. You know this. When you get cannabis sticky on your hands and you take a little alcohol on a tissue paper, it wipes that shit right off. So to solubilize the cannabinoids is nothing, right? So it's all involved is the solvent recovery. So that's the rate determining step. You could only make extract as quick as you could remove your solvent, right? So yeah, so absolutely when isolating not just a single compound, in that case you're isolating an extract, but if you want to take that all the way through a single compound, well, what you get out of the cannabis plant's not a single compound. So in order to make that into a single compound, you're going to have to do some kind of purification. In the case of most ways of purifying things, you could certainly purify things by distillation because things distill at their particular boiling point. The problem with cannabinoids, and if you compare CBD to THC, is their molecular weight is identical, right? They're just isomers of one another. So their boiling points are very, very similar. So they're difficult to kind of separate in a commercial operation to have one vat of CBD and one vat of THC. How they can be separated is by something called chromatography, and that's how we do the analysis. So when you send a sample to a testing lab, they do something called a HPLC, which basically separates out the individual components that are in the cannabinoid plant. Well, if you're doing that not in an analytical sense and just analyzing a couple milligrams, but now you want to separate out a couple kilograms using the same type of methodology, yeah, that can be used, but now you're using a huge set of equipment that costs hundreds of thousands of dollars. You have to be dealing with large amounts of solvent, which is usually typically very flammable solvent. So now you have to have all kinds of, to operate safely and to operate in a permitted way. Basically, you have to have a fire marshal, the person who's in charge of sending the fire crew to your lab and your operation to put out the fire at your facility. He has to agree with your operation. It doesn't have to be a he. Please don't be mad at me. He or she. That person, whoever is in charge of sending a fire crew to your facility, that person needs to know what solvent you're using, how much solvent you're using, where you store your solvent, how much you have in operation at one single time, because that guy or that person has the responsibility for the people who are putting their life on the line should there be a fire or an accident at your facility. So again, solvent extraction at commercial production scale is a rather hazardous operation, and that means that we need to have trained individuals back there who know what they're doing, who are well versed in fire safety. The facilities themselves have to be outfitted with fire safety countermeasures like sprinkler systems, fire extinguishers. safety showers, and those things have to be regularly inspected. Uh, so solvent extraction at the commercial level is certainly a significant undertaking. This isn't something you should be doing at home. In fact, one of the reasons why butane extraction got such a bad rap is because people were having fires because they were using fans to blow off their butane as they were evaporating the butane from their, backyard blasts. And what is a fan, Michael? It's an armature with a sparking motor, right? And now I'm going to send a cloud of butane that way. Who knows how many fires happen that way? But, I think solvent extraction, when done in a commercial setting, when done with the right equipment and a properly trained staff, is a completely safe operation. Look, I've consulted at probably about 24 different commercial extraction operations, and I could knock on wood say that we've never had an accident at any of the facilities I've been at. That's not to say that there aren't accidents that do happen from dumb things like using hair dryers with glowing red nichrome wires in places where there's volatile, flammable solvents. I mean, certainly there needs to be a certain education of the staff and the operators of those facilities to make sure that that can be done safely. And it's really important to have the safeguards in place to make sure that your product that you're making is free of solvent and that your SOP is pretty general. So a pretty uneducated operator can basically go in there and learn an SOP and run it time again and make consistent product.
Leslie has a follow-up.
Yeah, Mark, with all the different types of solvents out there, and each solvent has, they're selective on what compounds they're going to draw out of the plant. Like ethanol is not very selective. You're going to get a high yield. You're going to get a ton out of it. That's why it's so great for commercial purposes for pharmaceutical isolates. With the different selectivity of each solvent drawing different compounds out of the plant, if we were looking at full spectrum oils, FICOs, do you think one FICO from a specific solvent extraction is better than the others?
That's a really interesting question, Leslie. I never really considered it like that, but I think what I find is that if you're going after a dabbable product like a concentrate like this, where you want to basically get a product like this and put this on a nail and make what's called basically a full melt type extract, I think a closed loop hydrocarbon extract is superior to an ethanol extract. I know people have looked at making like an ethanol shatter, but problem is that ethanol is a rather polar molecule compared to butane,
Oh,
and that
I think I wasn't clear enough. I mean like medicinally beneficial, not aesthetically or whatnot. Is one maybe going to be bioabsorbed in the body a little bit better because it extracted the flavonoids versus the other one didn't extract the flavonoids or whatnot. So
yeah.
more
So
biochemically, not from a product standpoint.
yeah, I mean, I think your point's well taken, but I think that there is a relationship between those two things. You know how the consumer enjoys the product and how they consume it and they how it interacts with their body. I think has a lot to do with its efficacy. But you have a really good point in that if you really want a a fuller spectrum extract that's less pure in cannabinoids and has more of the other components, other extractables. I mean, hey, chlorophyll plays a wonderful role in the diet and in the body. I mean, certainly you could get your chlorophyll from a cannabis extract. Those flavonoids that you're talking about, yeah. So flavonoids are very interesting molecules because usually there's two portions to the flavonoid. There's what's called the aglycone, and then there's a carbohydrate segment. And you're probably aware of the compounds called um, uh, uh, anthocyaninogens, or let's see, anthocyanins, right? So the pigments that are in cannabis, like what gives granddaddy perps its perp color, and these compounds, these are all flavonoid type molecules, right? And so in the plant, and you bring up a really good point, if you did an alcohol extraction, and you did not distill that material, you would get both portions of the molecule. So you'd get the carbohydrate portion and you'd get the flavonoid molecule. But the thing is, Leslie, if you go to take that dark colored extract and now go to try to make a distillate, what's going to happen is the two components are going to separate, right? And your carbohydrate doesn't distill. Your aglycone will distill, and so you can get flavonoids into your distillate, but the carbohydrate portion stays behind and goes into the what we call the dregs of the distillate. So that doesn't distill. So
Now,
you
what chemical are you using to distill? What compound and what method are you speaking of?
So I'm saying that if you took like a cannabis extract and you did a ethanol extraction and you did a falling film recovery and you decarboxylated and then you did a thin film, a white film type distillation, the dregs are going to be where the carbohydrate portion of that flavonoid would be, and what would distill over would be the aglycone of the flavonoid. So quercetin is an example. There's many different flavonoids that occur in cannabis. One of the reasons why distillate is golden in color is because of the flavonoids. Flavonoids are highly colored. They're not there in a lot of concentration, but a little bit of molecule goes a long way. But your point is, Leslie, that if you wanted to use an alcohol extract, you're going to get more whole plant goodness from the extract than you would from the distillate. So while the distillate does enhance the concentration of the cannabinoid, so it drives up cannabinoid purity. I mean, ultimately, if you're distilling a hemp extract, you could go all the way to CBD isolate, which is your pharmaceutical isolate that perhaps you're referring to. The idea is that
I was a raw ingredient supplier in the hemp space for a while, and some clients wanted the CO2 extract. Of course, we could get into crude or distillate or even going through the chromatography and separating out, whatever compound you want. But just that initial crude extraction, the standard solvents that you get to choose from without getting into the boutique aspects would be traditionally ethanol, CO2, or a hydrocarbon like propane or butane or a mix of it.
yeah,
And they're going to be selective on what compounds they draw out of the plant material.
they
And
are.
some of them are, yeah. And, there's different compounds. When we start really thinking about the entourage effect and full spectrum plant extracts, I think we really need to differentiate between is there a difference and what is that difference? And I forget her name. I believe she's a PhD. I've met her at an international medical cannabis conference, but she swears that ethanol extraction, full plant extract, is superior as a medicine over CO2 or whatnot. And I don't know if she's really put that to the rigor or if she has what her method was.
Well,
But she's the only one I've come across that's actually trying to look at the difference of crude extracts. And, of course, like you said, you can distill it all you want, but just looking at the crude extracts, because they're going to have different compounds in each
they are.
one.
They
Yeah.
are. Yeah, so solvent is going to beat CO2 all day long. CO2 is not only a long extraction, so it's not economically as advantageous as a solvent extraction. The other thing about CO2, it's a hot extraction. I mean, some people have figured out how to do subcritical CO2 extraction, which is a little bit cooler. But in previous generations, people were decarboxylating cannabis and then extracting it. I don't prefer that myself. I think roasting cannabis before you extract it really puts a really negative flavor into the extract. The other thing is that CO2 has issues with you can't do fresh frozen by CO2 because the water will impact things. So yeah, for me, and for medical benefit, I believe a hydrocarbon extraction is one of the better extractions. Alcohol, the
Protein
temperature
capture.
at which the temperature at which you remove alcohol, you also end up removing some of the terpenes. So solvent recovery with ethanol is more of an issue than it is with butane. Butane wants to be a gas at standard pressure. So and propane just accelerates solvent recovery. So the people who are doing closed loop hydrocarbon extraction um, are going to be able to fill those ovens before the end of an 8-hour shift. And you're operating on very very thin margins where filling those ovens and getting that product out the door is absolutely imperative to try to reach profitability.
Thank you for all that.
Wow, that was fascinating trip down chemistry lane, right?
Engineering and economics, right? Chemistry is just the innocent bystander, right? It's all about how fast you can process and how you can optimize things. The other thing I would say, Leslie, is that there has been a considerable evolution in solvent extraction. I think at first, when people were starting to do operations based on CO2, I think they saw that CO2 didn't give the productivity that solvent based extraction. And ethanol, I think, is a great vehicle for hemp extraction because most of the hemp extractions aren't going to make boutique products like dabbables and whatnot that was feeding the cannabis market. So I think the closed loop extraction certainly had its place to basically make extracts that were basically consumed by cannabis consumers. Where ethanol, I think, works and the economics of ethanol works is at very, very large scale. At very, very large scale, if you're doing hemp operations where you're extracting anywhere between 50 to 150,000 pounds of material a year, or alcohol will win hands down. But there has to be a considerable.
Materials that material when you do ethanol, because I mean I went through the gambit of all this, and I've worked with farmers up to 200 acres, so we were looking at high yield
Large
and
scale, large
large
scale.
scale, and
Yeah,
I worked with tar and waters and all that, and my favorite ended up being CO2, and definitely not everyone could hit the yield numbers that you would need to make it economically your best bet. But the ethanol product was just such junk. It tasted awful. You couldn't
yeah,
make great product out of it. It was great if you're trying to take it to an isolate, but if you were trying to make any sort of usable oil in like a topical or whatnot, really you needed to go with CO2 and have those terpenes removed. Don't, not reintroduce them. And
right.
you can capture, the acid forms, like you were saying, the subcritical and supercritical aspects. But it's just I feel like there just still needs to be some deep diving into that, and I know that will come. It's kind of like us looking at pharmaceuticals, and they're all single compound. Maybe here and there we have some double compound, triple compound, but we'll get there, I think, with our research, because when we're looking at full plant extracts, we're looking at hundreds of compounds,
We
and
are.
that's a lot to trace. And maybe thank God for AI, maybe we can do that now, but it's a lot to trace. But I personally would love to see, like I said, some more deep diving into that to see if there's any real benefit of one over the other, or just the plant itself. Should you just infuse the plant into a lipid and consume it in that manner? Is that the best medicine?
I
So
think it might be. I think it might
yeah.
be. I think it might. I mean, I trust the plant, which has had the time course of evolution to evolve its traits, right? And now you have humans who have been basically breeding for flavor and THC content. So to me, I trust the plant more than I trust some hillbilly chemist down in Tennessee in the back of a airplane hangar on a hemp farm, you know?
With some propane. Yeah.
All right. Well, thank you for that, Dr. Sheldon and Leslie. Let's get on to our final question. Mike D, you're up.
Oh, I need the question, man.
There you go.
Okay. So looking ahead 5 to 10 years, what breakthroughs in cannabis chemistry do you believe will most fundamentally change how cannabis is used medically?
Oh, what a great question, you know. We do have a crystal ball, right? We could see into the future, right? Do you believe me, Mike? The crystal ball, right? The Grateful Dead catalog. No, the crystal ball that we could. It's so interesting because we stand on the shoulders of giants. Raphael Mechoulam and Professor Roger Adams and Wood Spivey and Easterfield, the first people that isolated THC in the laboratory. We wouldn't be where we are today to be able to look 5 to 10 years in the future, Mike. We're standing on this solid foundation, which is the shoulders of those who came before us, and we could launch rubber bands at stars here because of all the work that's been done before. Think about what's been done. We've established what are the compounds in the plant. We now know the receptors that they act on in the body, right? We all know that all the pharmaceutical companies, without exception, all made new molecules, not phytochemicals, but synthetic cannabinoids to act on those very receptors, right? So the cannabis plant taught the pharmaceutical company, hey, these receptors right here, this is what makes people high and happy and what makes people horny and hungry and the reason why people forget things and why people remember things and this thing. It's the endocannabinoid system is the hard wiring in your body. It wires all other systems, the musculoskeletal system, the brain, the central nervous system, the lymphatic system, the circulatory system. It's all governed by the endocannabinoid or endocannabinoid like molecules. And so when I think about 5 to 10 years from now, again, it's almost naive because we're in the middle of this continuum. It's hard to think about this, but after we all die and we look back, or the future, the people, we're not going to be here anymore because we're going to be dead, right? The people who are alive in the future are going to look back and they'll be like, who is this ATN Fontaine guy? And what is Berkeley's patience groove? And they'll look at, who is this Mark Scialdone guy? And what did he read? So we're in this continuum, Mike, and it's so beautiful, man. I mean, it's like we lived in this lifetime while Jerry Garcia and Bob Marley and Miles Davis was alive, man. And like we and I don't know, man. I mean, like I think a lot like in terms of the Grateful Dead because I think what the Grateful Dead's business model was
Yeah,
to
me too, man. Like all the time. I don't, there ain't a day that goes by where I don't listen to the Dead. I got them on right now in the background.
yeah, I mean I listen to Dave Lemieux's show every morning
Yeah.
when I have my coffee in the morning.
Big
Uh,
Steve every
Yeah,
Thursday.
Big Steve. I called into Big Steve a couple weeks ago.
Did you?
Yeah,
Oh, we had him
yeah,
on the show.
yeah,
We had him on
yeah,
the VAC.
yeah. I called into Big Steve and we talked briefly about the Beast. Remember the ring of drums that they had back in the '80s, and Mickey and Billy would get back there and start beating
Oh,
drums.
yeah.
So no, but I think what's really cool when I think about the future, Mike, what excites me about the future is when I go to my laboratory and interact with my students. I'm going to I'm an invited speaker at the American Chemical Society's national meeting. We have a cannabis chemistry subdivision there that I was a founding member of, and we're having a symposium in Atlanta in a couple weeks here, and I'm bringing two of my students with me. And as a professor, I'm almost getting tearing up right here. That's a very, very proud moment when I'm going to be looking at my students standing in front of their posters representing the work that they've done in my laboratory to further the science of cannabinoids. And so I'm going to have an effect on these students for they're going to remember me for the rest of their life, you know? And the wonderful thing about that is that then they're going to be the professors and they're going to be the scientists and they're going to be the dispensary owners and the insurance people and all the other people in the industry. So I think I have hope that this generation that we're educating right now, I don't know if it's generation X, Y, Z, I don't care, doesn't make a difference. You're only as old as you act, right? I think that's what Jerry tells us. So, to me, um, I give of myself into my students and inspire them with teaching them the principles of science so they can go off and be leaders in the future in science. And it's wonderful. We're doing cancer research that we might invent the cure for cancer or autoimmune disorder or traumatic brain injury. And it'll probably be developed long after I'm gone. But I play an integral role in making sure that Professor Meshulam's foundation gets built higher and higher. So the current frontier has a shorter distance to launch those rubber bands at stars.
Wow, wow, wow. What a great discussion. Cannot thank you enough, Dr. Mark, for coming by and blowing all of our wee little minds with all the fun talk. We knew this would be epic and fun, and of course, you definitely made it that. Cannot thank you
Oh,
enough.
thank you. Thank you,
Uh,
ATN. ATN. I look at you like a brother and a mentor.
oh,
I'm very fortunate to be within your sphere of influence. And I remember the last time I was in the Bay Area and I was like, hey, Etienne, I'm coming over. And we had a nice little session together. And that really made my day, man. And I can't wait to do that again. I tell you what, I'm coming out there for Can Med. I think we're flying through SFO. So I'll
come
drop you a
on
line.
by, Mike D.
Yeah,
Mike D. When I know, Mike D. will probably come on over to the house
Yeah.
and we'll sesh.
I
We'll
can't wait.
We'll smoke one of his good joints, man.
Yeah,
yeah.
man.
Mark,
Hmm?
Mark, our facility is 10 minutes from SFO. We do no to living soil. I would love to give you a tour when you come in.
Oh, okay. Thank you. Is that Nate?
Yeah, Nate.
Yeah,
Nate,
that's it.
Yeah, thank you, Nate. AT hook us up together. We'll definitely, yeah,
absolutely,
love to.
absolutely. Yeah, you want to see that garden? It's gorgeous. All right. Well, I can't thank you enough. So I want to thank our council members for joining us tonight: Nate Landau, Rachel, Leslie, Mike D, and Mike Crowitz. I'm your host, ATN Fontan. And thank you, Dr. Mark. This has been VAC's Roundtable number 98. Dr. Mark Scialdone, Cannabis Chemist.
Professor.
Yep. Well, I call you Doc for a reason. He's a professor. So there you go. So thank you very much, Doc. We'll talk to you all soon. We're going to have
Peace.
a little bit of a hiatus because we're going off to the UN next week. So we are not going to be around for a couple of weeks, but we'll be back at the end of March with another roundtable. So thank you very much, everybody. Have a great day.
Awesome.